So first, I'd like to introduce both the senator and the congressman to the stage. First, Senator Tester, who is a lifelong farmer and former teacher. Teaching is actually something I saw both of you gentlemen have as a common trait to go along with your chairmanships. Senator Tester was elected to Senate in 2006. And this past year, he assumed chairmanship of the Senate Committee on Veterans Affairs after serving as the ranking member. Some of the priorities that the senator has focused on as both a ranking member and now as the chairman is connecting more veterans to mental health services, ensuring care for those exposed to Agent Orange, and then also improving services for women veterans, among other topics that he's had. So thank you, Senator, for joining us. Congressman Takano, like I mentioned, is also a teacher. He was elected to Congress in 2012 and became the chairman of the House Committee on Veterans Affairs in 2019. Some of his priorities as it comes to veterans is increasing access to healthcare, connecting student veterans to job opportunities, and really creating a culture of excellence at the Department of Veterans Affairs. So thank you again, gentlemen, for joining us. So I wanted to kick off our time this morning with you, focused first on the American Rescue Plan, such an important piece of legislation that has passed and signed into law by President Biden. I was wondering if we could talk, such a massive bill there, talk a little bit about the programs that really benefit veterans. And if Senator Tester, could you start for us?
You bet I can, and thanks, Michael. And I want to thank GovernmentCIO Media and Research for putting this on. I very much appreciate the opportunity to visit with folks, albeit virtually. Look, there's a half a dozen things that stand out in the American Rescue Plan. These are things I've heard from veterans on the ground and folks all around the country, quite frankly. First of all, first and foremost, is bolstering the vaccine distribution. This bill is going to boost the vaccine distribution and the outreach across the country, particularly in rural areas, which I think is really important because we have large numbers of veterans living there. And so I think that's number one. Number two, the claims backlog, and we've seen how this pandemic-induced backlog has had its impacts. So I think it's going to provide funding to reduce that backlog. The co-payment burdens, and right now, when folks potentially don't have a job and they're worried about the pandemic, the co-payments are the last thing they want to have to worry about. So this package is going to eliminate those, which is, I think, really important. It's got new job training benefits in it. And so employment is always a challenge out there, and making sure that our veterans are able to get back in the workforce is very important. This bill has a VA Rapid Retaining Assistance Program. It's going to cover the cost of training and quite frankly, get our veterans into high demand jobs much quicker. I'd say assisting vulnerable vets. This package really takes an aggressive approach at assisting vulnerable vets with bolstering mental health care resources, medical equipment, additional resources for women vets and those in risk of homelessness. And finally, I would say what also stands out to me is support for state veterans home. You know, the federal government doesn't typically support state veterans home. That's an obligation to state. But in this particular case, they're serving veterans, and this bill will mitigate funding gaps and help their operations with additional construction grants for shovel-ready projects. It's a one-time payment, but I think it's a wise expenditure of dollars.
Excellent. And Congressman Takano, could you, are there any pieces that you'd like to also highlight I
think Chairman Tester covered the bulk of what's in the bill, the reconciliation package or the American Rescue Plan for veterans. I just might embellish on a couple. The big chunk of the $17 billion that was allocated to specifically veterans also is mainly in the area of healthcare. We know that a lot of veterans are going to lose or have lost jobs or will lose jobs, but hopefully I'm seeing signs of a burgeoning economy as a result of this bold plan. But nevertheless, there was some, I think, planning in place to make sure that any veterans who lost their jobs and therefore also lost their insurance, they would become eligible for VA care. So we were anticipating an uptick in the use of the VA for their health care. We also, and so the secretary has the authority to, humanitarian authority to include veterans who actually don't normally qualify for VA healthcare to be covered by that. We also just know that a lot of veterans during the pandemic might have been putting off their healthcare. That means I think greater utilization of VA as more veterans trust coming back for in-person appointments. I would add one more thing is that it may seem tangential, but it's really not. Chairman Tester mentioned our rapid retraining programs. We know that we're going to see Americans, whether veterans or not, try to utilize going back to school to retrain. And one of the things we got done in this bill, which was the goal of many veteran service organizations, was the closure of the 90-10 loophole. That is a big deal, that there was an agreement between the House and the Senate. Republicans, Democrats alike had problems with this loophole. And what does this loophole do? This loophole allowed predatory for-profit colleges to really target specifically veterans for their GI Bill benefits, which are very generous, drain them of those benefits, and in return give them very subpar educational credentials, which often ended up in no jobs, no credit that can be transferable. This is a big deal to help to protect veterans as they're trying to get their lives back on track after this pandemic.
Okay. No, absolutely. And speaking of the pandemic, there's such a focus right now on the distribution of vaccines and getting as many individuals, and for our topic this morning, veterans protected. This week has been especially important with the passage of the unanimous passage of the Save Lives Act within the Senate, followed by the passage of the VA Vaccine Act in the House. Chairman Takano, could you start by talking a little bit about what these two pieces of legislation mean for veterans and the communities, and who really qualifies for the different vaccines right now within the veteran community?
Well, many Americans do not know that every veteran does not get health care from the Veterans Health Administration or the VHA, that not every veteran is qualified, is eligible. And so we have about 9 million or so veterans that are actually enrolled in the VA healthcare system. And eligibility is a little bit of, there's some complexity to it. You got to have a service connection to your health condition, and you've also got to have an income test. And so what we saw happening, and especially places like Florida, is 95-year-old veterans who fought in World War II, who might have been just outside the eligibility window and made just a bit too much money, but were having trouble getting vaccine in the community, and they knew that the VA had its own allocation of vaccine. They got in line, and then the VA had to turn those veterans away because VA did not have the authority to vaccinate folks that were not enrolled in the VA. We heard about this on the House side, and we got to working with the VA Office of General Counsel to get the language just right. So in the VA Vaccine Act, which we passed in the House, I don't know, a week or two ago, it would give the Secretary authority to, where available, vaccinate veterans that meet the VA's qualifications, that they meet the age requirements, et cetera. And if they have vaccine, they should go ahead and vaccinate those veterans. We didn't want to see those veterans turned away. The bill also allows for caregivers who are enrolled in VA's caregiver programs to be vaccinated. And we take care of overseas veterans on the foreign medical program. So we wanted to just make sure that we gave the Secretary flexibility in this pandemic and going forward. And I'll let Senator Tester explain what's going on with his legislation.
Yeah, Chairman Tester, what did it mean to you to have the Save Lives Act pass unanimously in the Senate? And then if you could talk to a little bit of what are some of the next steps now and what still needs to additionally be done to ensure as many veterans as possible can get the vaccine as soon as possible.
Yeah, well, Michael, when it comes to the vaccines, it's a good news, bad news story. The good news is the VA is getting vaccines into people's arms, I think better than anybody in the nation. They're doing an outstanding job. The bad news is we don't have enough vaccines. We need more vaccines. It was the reason we passed the recovery plan 10 days ago. It's really, really important that we get more vaccines into the VA. And they have shown that they have capacity to do double what they're doing right now. And so getting those vaccines in the door of the VA so they can get them in veterans' arms is really important. A couple, 3 weeks ago, we had a hearing in the Senate Veterans Affairs Committee, and we talked about the Saves Lives Act. That was the impetus for it. It really builds upon the bill that Chairman Takano just got done talking about that he did with Ranking Member Bost. And I think that it's a good piece of legislation because it encompasses everybody around, it encompasses the veteran and everybody around the veteran. And I think it's really important, including spouses, including caregivers, including surviving spouses of certain deceased veterans, Champ VA folks. And I think it's really a piece of legislation that really, more than anything, and the VA doesn't traditionally give caregivers vaccines if they're not a veteran, or spouses vaccines if they're not a veteran. But this really it is really necessary to get the pandemic behind us, number one. But number two, to really make the life more certain for the veterans. I think it's really important in that regard. And since the VA has the capacity to do more, let's let the VA help everybody get this pandemic behind us. And so passing this bill really helps the veterans, helps the people around the veterans, and I think it helps the nation as a whole.
Excellent. Well, another topic that's really drawn a lot of focus during this past year is mental health services. I mean, this past year has been tough on a lot of folks. And the veteran community is especially vulnerable when it comes to this. Both of you have passed important pieces of legislation when it comes to connecting more veterans to mental health care. I want to name them now, the Commander John Scott Hannon Veterans Mental Health Care Improvement Act, as well as in the Senate, and then the Veterans Compact Act in the House. Again, both very important pieces of legislation and in an area where really important to connect veterans. I know, especially with veterans in rural areas, is especially important for you, Senator Tester. What could you talk a little bit about the importance of these pieces of legislation, what they do for the veteran community in this space, and go from there?
Yeah, absolutely. It along with PTSD, may be the biggest challenges we have out there in the veterans community. I mean, I will tell you that one veteran losing their life to mental health issues is one too many, and we're losing far more than that. And this is a puzzle that we've been trying to get fixed for a long, long time. And we've passed a number of bills. You mentioned two of them, but there's been bills over the last 10 years to deal with the issue of mental health problems within the VA. And the John Scott Hannon bill is the last one we did. It's pretty comprehensive. It's out of the box thinking in a lot of the cases. But the bottom line is that, it's going to do basic things like bolster mental health workforce, but it's also going to do things like work outside the box stuff like agritherapy and animal therapy and recreation therapy. Couch is good and it's effective, but oftentimes these other methods can be even more effective. And so I think it's really important that we get this bill implemented correctly. It has a lot of other things in it too that I can go into if you want. Otherwise, we'll let it go. But the bottom line is this: I've had a number of people say, "So what are your priorities as chairman of the Senate Veterans Affairs Committee?" And I do have a lot of priorities, including Agent Orange and burn pits and a lot of other things. But getting this bill implemented correctly is at the top of the list. The John Scott Hannon Veterans Mental Health Care Improvement Act is a piece of legislation named after a veteran from Montana that took his own life. And this bill, if implemented as Congress intended, I think will be a valuable tool to the VA to deal with mental health issues within our veterans community. And, everything from destigmatizing mental health issues to making sure we got more folks on the ground, all those are really important. And in fact, recently I sent a letter to Secretary McDonough telling him to expedite the provisions of this historic law to be able to connect up with veterans nationwide. It's one thing for Congress to pass a law. Now it needs to be implemented so that we can get it in the hands of the healthcare professionals, in the hands of the VA, so it can really make a difference. I'm excited about this, but it needs to be implemented sooner rather than later.
Excellent. Chairman Takano, I know this is a very important topic to you as well. Could you talk a little bit about the Compact Act? And then also, I know telehealth has become, been able to provide care to a lot more veterans and making, services such as mental health in a lot of ways more accessible at a unique time. Could you talk about a little bit about that as well as that important piece of legislation?
Yes. Well, suicide prevention was the number one priority that I directed my committee staff to work on in the 116th Congress. It was really gratifying to be able to pass the John Hannon Act out of the John Scott Hannon Act out of the Senate, and I'm really pleased the Senate reciprocated and put through the Veterans Compact Act, which came out of the work of the House committee. What does the compact do? Very simply, it gives the VA a very important tool, which is to be able to tell every veteran, regardless of their eligibility for VA care, if they're enrolled in the VA or not, if they served in uniform for the United States, with a very small exception. We don't for dishonorably discharged veterans. A very small portion of the total. But most veterans, regardless of eligibility, will be able to call the VA hotline. And if they're having an emergent mental health issue, they can call that line and they can be connected with mental health care, whether it's inpatient or outpatient, and not have to worry about seeing a bill. So we can get that message out to veterans. That is so important so that the veteran or their loved ones know there's no hesitation to call that hotline and to get connected with care. I agree with Chairman Tester. The devil is in implementation, and both the Commander John Scott Hannon Veterans Mental Health Care Improvement Act and the Veterans Compact Act together are two major, I think, improvements in the toolbox that the VA has to use to prevent death by suicide among our veterans. It's just tragic. These two bills actually give VA a couple of tools at a time when we know that veterans, along with all Americans, have suffered through a pandemic. And we know that mental health conditions will have been aggravated by the pandemic, and we'll need that help. Now, telehealth at the VA the use of it has just shot up tremendously. VA had to rely on it quite a bit. Quite a bit's kind of an understatement. And I expect that the VA will continue to use telehealth with veterans. And I see this trend happening in other federally supported healthcare programs as well. I'm seeing FQHCs and other folks looking for ways to continue being reimbursed for telephone consultations, and we need to make sure we get that right. We don't want to see that abused in the future, but we've seen a tremendous change over there. But telehealth is not a substitute for getting physicians and specialists into places like Montana, where Chairman Tester, what the state that Chairman Tester represents, and states like Kansas that Senator Moran represents. I really hope to work with the Senate to look at ways to deal with at the very low end, the estimated 55,000 practitioners, doctors and specialists that we need to train going forward, especially of need right now in the VA are psychiatrists. And there's only so much that telehealth can do. So telehealth has been a tremendous improvement, but it's no substitute for adequately staffing the VA medical system, and the medical system of the nation as a whole. And we really need to figure this out. I mean, this is an unspoken, I think, need of the country coming out of this pandemic. It's not been talked about in the media, but I really hope that we can work on this. You know, the VA funds about 10% of the medical residencies out of the total pie of medical residencies. And we need to take a look at what contribution we can make toward what needs to be a national priority.
Michael, I just want to add one thing to what Chairman Takano said. He brought up a point that I think is very, very important to drive home. We've just come out of a pandemic, and we're not out of it yet, but we're working in that direction, where isolation is one of the cures for the pandemic. Isolation is a real problem when it comes to mental health. I think we're going to see some challenges with mental health continuing moving forward, and we need to be aware of that, and that's why the two bills that we've just been talking about are so important to get implemented correctly.
Absolutely. Thank you, Senator Tester. One of the issues too, that have followed this pandemic was following the shutdown, the hit that the economy has taken, and the skyrocketing unemployment rate that included the veteran community. How have the two of you worked, and how can the Department of Veterans Affairs do more to ensuring that veterans can get back to work? I know that's an important subject for both of you. If you could start, Chairman Takano.
Well, we've already mentioned the money allocated out of the American Rescue Plan for rapid retraining of our veterans to get them into programs which will rapidly retrain them for new opportunities. I already mentioned how we're looking to actually improve and make sure we put guardrails on the training programs that are out there. The degree programs, the kinds of career and technical programs that veterans may be getting into, or even starting using their GI Bill benefits, those that have them. We got to make sure the quality of those programs are good. And I think we appropriately took action on the 90/10 loophole. We've also well, the main thing is that I'll tell you that the rescue plan included about $386 million, almost $500 million to get veterans back to work. It's a strong first step, but there's much more to do. We have a lot of, I think, work to make sure that we review the programs VA already has, like VRNE and the GI Bill, and look at the other programs like the transition programs that we have for the military. We're constantly looking to fine tune and improve those programs as well.
Excellent. Chairman Tester?
Yeah, my friend Senator Brown always talks about the dignity of work. I think work is really, really important. Having a job, not only to support the family, but it's good for mental health. And so I think that in particular, the VA Rapid Retaining Assistance Program is going to be it's going to be very effective to get folks back on their feet that have lost their job, get them retrained and back into the employment cycle we have in this country. I think it's really, really important. Everything connects in a person's life, and having a job is really important, and making sure that you have access to training to be able to get those good jobs, which is what the Rapid Retaining Assistance Program will do, I think is critically important. And I would just also say that I very much appreciate all the work that Chairman Takano has done on this issue. He's really been a leader on this, and it's very much appreciated.
Okay. Can I just add, let's not forget that the general elements of the entire plan, which help veterans too. The $1,400 direct payments will help many of our veterans. The extension of UI, of unemployment benefits through September, is going to help veterans as well. The general design, it wasn't specifically for veterans in that case, but the general design is going to definitely uplift veterans as well.
A lot has been made. We have a couple minutes left, so I wanted to get you guys out on this. What if some of the what do you see as some of the lasting impacts that are going to have on the Department of Veterans Affairs following this pandemic? I mean, this has really just shaken the country to its core in a lot of ways, but in a lot of ways too, forced different agencies such as the Department of Veterans Affairs to really, come up with solutions quickly. In terms of access to healthcare or distribution of benefits, what do the two of you see as some of lasting impacts that might be solutions that were forced upon the Department of Veterans Affairs that actually might be continued into the future? I'll start with you, Chairman Tester.
Well, thanks for the question, because I think it's always good to look to the future, and the impacts of this pandemic aren't going to go away immediately. They're going to be around a while. And I think they start with something that was talked about earlier, and that's a huge backlog of deferred and delayed healthcare that people just didn't want to go out because they were afraid of getting sick. And we've already seen an uptick in veterans that are coming back to the Department for care once they've been vaccinated. And I think this is going to continue, and I think the backlog is very significant, and it's going to put pressure on the VA in a major way to be able to take care of these deferred healthcare needs in a timely manner, and specialized care, and the list goes on and on. I think we're also going to see, and there was a movement before the pandemic, but I think the pandemic has intensified it, a move towards telehealth. The challenge has always been connectivity, but the truth is, if you can get connectivity, what we have seen in telehealth, it's nice to be there eyeball to eyeball, but when you can't do it, telehealth can help get the healthcare that a veteran needs. And I think that's going to continue. And I think that that's not necessarily a bad thing, especially when you're in rural areas a long ways away from healthcare, or if you're in crisis with mental health conditions. Getting help ASAP is also very, very important. So I think those are two things that come to mind, but there's also some other things that I'll leave for Chairman Takano.
All right, Chairman Takano, thank you.
I agree with Senator Tester about telehealth. My comments about needing more physicians, they're not contradictory. Even if we're going to get more and more services out to people even via telehealth, we're going to need the practitioners, and we're going to need the connectivity. Hence, I'm looking forward to making sure in the infrastructure package that we're working on that we get rural connectivity. We end the digital divide. We need devices, and we need the broadband to make telehealth work, optimally. So we've seen the nation move to telehealth very quickly, and VA adjusted very quickly to that. But we still, even among our veterans, we need to have ways in which we get the necessary devices in their hands. I think the American public, and if they haven't seen it, they should know about it. And Senator Tester said this before, Chairman Tester said this before. The VA has done, they've shown their capability of getting vaccines into the arms of veterans and to the massive VA workforce. They've been among the most efficient and effective vaccinators. They've been very competent at that. I think this needs to get out there. We also know that of the long-term care facilities that VA manages itself, what they call community living centers, they have had very, very few fatalities, and they've controlled infection very well. Why? Because they were adequately staffed, and there was adequate oversight, because there's a lot of accountability with these government run facilities. Not so with the for-profit long-term care industry, the for-profit nursing care industry. 40% of the fatalities of COVID-19 were occurring in these for-profit or these facilities, you know, in the more civilian sector. I think VA has a lot to offer in terms of a larger conversation about how we bring greater accountability and oversight to this sector of healthcare, many long-term care, and what needs to be done to make sure that all Americans, as they age, do not have to worry about going into facilities that are subpar. We need to do more in terms of home caregiving, and VA has a chance to be a model there. My hope is that this pandemic, as we're coming out of it, will showcase a lot of VA strengths that were maybe hidden or not really seen.
Okay. Well, thank you both so much for joining us this morning, Chairman Tester and Chairman Takano. It really is an honor for us to have the two of you. I'll speak for myself as well as a veteran. Really excited to see the different programs that you're putting together in the spirit of supporting that veteran community. So thank you both for taking the time and sharing some of your views on this important topic.
My pleasure.
All right, excellent. Next up, we are going to have a focus on boosting the veterans' digital experience. It's going to be really focused on how the VA has improved access for veterans through changes made to the digital experience for the Department of Veterans Affairs. It's going to be moderated by Megha Chokshi, our Senior Vice President with GovernmentCIO. So passing on to you. Thank you.